Good afternoon, everyone. Welcome. I am so very grateful that you've joined us here today. I'm Alina Dorian, the Associate Dean for Public Health Practice, as well as Equity, Diversity, and Inclusion at the UCLA Fielding School of Public Health. But I've also been a school principal for 10 years, and I am extremely proud to kick off the first of a series of webinars titled Principal Practices for Safe Schools. I want to take a moment to thank our collaborating partners, the UCLA School of Education and Information Studies, the California Safe Schools for All team, the California Department of Education, and our California Connected Consortium consisting of the California Department of Public Health and our academic partner, UC San Francisco. As you all know, the state's Safe School for All team released new guidance for school reopening in mid-January. And under that K-12 consolidated framework, the state provided detailed guidance around the school's COVID-19 safety plan and its two main components, the school guidance checklist and the Cal-OSHA COVID-19 prevention plan, lovingly known as the CPP. So today, we're lucky to have with us our insightful state experts who will provide an overall view of the guidance, but specifically focusing in on one of the main changes that's been made around small, stable groups and what it all means, really helping us understand and think through the why and the intent behind this guidance so we can better understand what this means to implement and operationalize in our school system and in our buildings. We're also joined by a panel of incredible educators, esteemed school administrators who will pose questions to our state partners to create a dialogue to better inform, empower, and create confidence in the decisions we need to make to open our schools and to keep our schools safe. So we begin today by hearing from our state partners and then transitioning into Q&A from our education partners. I hope we keep a bit of time at the end so that we can get to your questions, but please use the Q&A button, pose your questions there. Your questions and comments are also very valuable for us and helping us really design this series to truly meet your needs. So without further ado, let me introduce our guests, beginning with our state partners. We're honored to have with us Dr. Naomi Bardach, who since December has been serving as California Health and Human Services Agency's lead for the multi-agency Safe Schools for All team. Dr. Bardach is also an associate professor of pediatrics and policy in the Department of Pediatrics and the Philip R. Lee Institute for Health Policy Studies at the University of California, San Francisco. We're also very happy to have with us Dr. Stephanie Gregson, Chief Deputy Superintendent of Public Instruction at the California Department of Education. Dr. Gregson is responsible for the overall operation and administration of 6 branches, where she serves as lead learner, convener, and facilitator, ensuring all students in California are well cared for and well prepared for the future. We also have Ms. Lisa Constancio, Deputy Superintendent of Public Instruction at the California Department of Education. She is responsible for overseeing the operation and administration branch, which includes government affairs, school fiscal services, school facilitation and transportation services, fiscal administrative services, and charter schools. She's also the department representative on COVID emergency response efforts and State Superintendent Tony Thurman's designee on the Community Vaccine Advisory Committee. We're also extremely honored to have with us our incredible school administrators. Today we have Ms. Janet Bianco, the Chief Administrator of School Leadership at the Rosedale Union School District. Prior to this role, Ms. Bianco served in Kern County Public Education for 20 years at both the elementary and middle school levels as a classroom teacher, a dean, site principal, and management analyst at Kern County Superintendent of Schools. The Rosedale Union School District has welcomed students on campuses since mid-October 2020 under the hybrid model. With us also is Ms. Heather King, the principal of Foothill High School, located in Twin Rivers Unified School District in Sacramento, where she has served for the last 5 years. And finally, Dr. Georgia Lazo, the principal of UCLA Lab School. Dr. Lazo has been an educator for almost 30 years and has taught at the elementary, secondary, and adult school levels. Before joining UCLA Lab School, she served as a director of instruction for LAUSD and was the founding principal of the UCLA Community School, a unique partnership between LAUSD and UCLA. It was a mouthful because they're incredible. So once again, I thank you all for being here. And now it is my honor to invite Dr. Naomi Bardach.
Hello, I'm going to share my screen so you guys can see some slides. Thank you for the introduction, Dr. Dorian. And just let me get to the top. I'm just the beginning sort of framer of this conversation. As you heard already, I'm the lead for the Safe Schools for All team at the state. Just to sort of set the context a little bit, you know, what are we doing? You know, what is this whole new thing that we're sort of talking about? Why are we doing these webinars? Why are we offering all sorts of technical assistance? So the governor in late December, you know, announced a plan to really try and support schools being able to open for in-person instruction in a way that that really, even in the midst of, like, we were in the darkest days of the pandemic, and he still wanted, and I think in general the community wants us to be thinking about how to do in-person instruction and how to plan for it, even if case rates are very high. We know that when they go down, if we haven't planned ahead of time, we're not going to be able to open. And so we learned that in the fall, and so that's part of the goal of focusing on it even in late December. And that involved investments in safe schools through technical assistance, PPE, testing supports. We also put out the consolidated guidance on January 14th, which is actually the goal of, or the focus of part of what we're talking about today. And then there's ongoing engagement in future sessions that the UCLA and UCSF teams are leading, but UCLA in particular, Dr. Dorian, Dr. Pralep, and the team is focusing on supporting school administrators, school leadership to really do the implementation piece. So as I mentioned, there's a plan. It was announced December 30th. It established the Safe Schools team. We had that consolidation of existing guidance, and the framework is actually built on these 4 pillars that you see here. Funding, which is still pending legislative approval, actually. Safety and mitigation measures for classrooms, hands-on technical assistance for schools, which I'll show you in a minute. And then transparency and accountability, and that's coming soon. The transparency piece is a map showing where schools, what the opening status is for schools throughout California. At the district level for public schools is the primary mode of learning, distance, hybrid, or in person, and then 2 other maps that show the charter schools and the private schools, and that's going to come out hopefully within the next week or so. We're going to be sharing that data. So I just want to frame the conversation with what is the pathway for safe schools, safe in-person instruction. On one side, we have a guardrail that says, you know, if we don't follow the public health guidance and all the safety layers and mitigation strategies that we know work for schools, and schools open, it can be under unsafe conditions and lead to community transmission and transmission in the school itself, you know, putting at risk the students and the teachers and student and teacher families. On the other side is, if we don't recognize that the mitigation layers allow us to do in-person learning, then you have a lot of students stuck forever since last March without a whiff of in-person instruction, still in distance learning. And we know so much more than we used to about how to do it, and we know how to do it safely, that we don't want to do that guardrail either. So we don't want the crash on either side. We don't want it to be unsafe. We also don't want people to stay in distance learning forever when we know how we can do it safely on that straight path forward. That helps us actually to do the right thing for everybody. So the materials that are you know, helping people in this effort, there's the COVID-19 Reopening Public Health Framework that just came out January 14th. There's also a really wonderful reopening educational guidance that is from the California Department of Education, and Lisa and Stephanie will be able to talk to that a little bit more, and specifically around the stable groups piece. This is a schools hub that got released actually in January. There was a lot of calling for, could you guys put all your schools guidance in one place, because it's kind of everywhere and we're having trouble finding it. So we did that because it is the right thing to do, and actually really trying to support people in their implementation. So it's schools.covid19.ca.gov. And you can see there's two buttons. There's a school administrator button that's for TA request, technical assistance request, that you can put your request in through there. On underneath that is actually a large layer of people who are answering tickets, / also connecting them to subject matter experts. So subject matter experts like Lisa Constancio and Stephanie Gregson, who are with us here today. That's the type of expertise that you can get access to if you need it through the Technical Assistance Hub. And then a concerns portal for school staff and parents, and we're soon to add a drop-down option for students as well, because that's an important voice. And then this is lower down on the Schools Hub, so you just scroll down the page of what I just showed you, and that's where you can see the schools guidance, school center testing, and then also there's the checklist, which I'm sorry, it's not actually on this on the screenshot. It's just down one little bit. You can see the picture for the checklist, and that's just to explain to you guys and say out loud, and I'm happy to field questions about this later, that the COVID safety plan includes those two pieces: the COVID prevention plan, which is your Cal OSHA plan, which is something that Cal OSHA emergency regulations came out in late November, and so most schools have a COVID prevention plan based on Cal OSHA because they had to put one together based on those regulations. And the other piece is the checklist, which is the student-specific parts of school of the school's guidance. So Cal OSHA only addresses the adult parts of it. Some of which are going to be generalizable to students because it's things like ventilation, and you don't have to say something different about ventilation for students than you do for the adults. But then the checklist does cover things that are specific to students. So those are the two basic things. And if you are not open and you are not planning on opening, you don't have to think about the COVID safety plan because it doesn't have to do with you if you're not going to open. Those who are already open, they can just fill out those two pieces and post them to the website. Those who would like to open and they are in purple and they want to open for TK through 6th, that requires a submission of the COVID safety plan to public health, your local public health, as well as to the state team. And there's a review process, and that's all outlined in the guidance, but that's just to briefly go over sort of what those pieces are. So other goals for today, and what I'm going to tee you up for a little bit, is a focus specifically, as Dr. Dorian mentioned, on stable groups for middle and high school curricula. I'm going to present the data on transmission in high schools and middle schools to illustrate the importance of the stable groups, sort of like the why, like why is it so important? Because it is a heavy lift for schools because of the departmentalized curriculum often in the middle school and high school. And then educational experts, like I said, Lisa Constancio and Stephanie Gregson are here to talk more about that, to provide guidance regarding how to actually operationalize the stable groups, because there's a bunch of different ways of doing it. And when people first hear about it, they feel a little kind of deer in the head, like how in the world am I going to do that? And it's really helpful to hear about the different options and the pros and the cons of each one of them and how they might be feasible. So just also one other thing to explain what's a stable group versus a cohort, because there's some confusion around language. Stable groups in the context of the guidance and generally speaking just means a group of people that stay together, do not mix with other stable groups. So the easiest example is an elementary school classroom that has a teacher and a group of students, and they do all their activities together throughout the day, and they don't mix with other members of other stable groups. So they're not going out to recess with other kids and mixing around a lot. They're just their own stable cohort, stable group. The difference between a stable group and a cohort, so we say stable groups in the California guidance. Many other people use the word cohort. CDC uses the word cohort. Some people call them pods. And it's just that in the California context, there's another concept of cohort that refers very specifically to a very specific thing in the school's context, which is you have at the most 16 people coming into a learning environment while the students would be in distance learning. but they're getting some kind of specialized services on site in a small group of 16 people or less. That includes staff and students, and that's called a cohort. And there's very specific guidance around how do you do cohorting, and you know, what are the rules that apply, etc. So we're talking today about stable groups, and I just wanted to help clarify that definitions because I know it can get a little confusing. So just to set the stage about, you know, where do stable groups fit into the whole picture. We know a lot more now than we did in March. In March, we didn't know how to do safety mitigation. You know, what did it look like in COVID? Now we know mask, 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 physical distancing, stay home when you're sick, or screen for, and doing the symptom screening, good ventilation, symptomatic and asymptomatic testing, and then the stable group concept. So it's one of the layers of the safety mitigation. We know that the more layers you have, the less likely it is for any virus to transmit on the school campus. And we've seen in multiple different studies that as long as layers are in place, there's very, very little to zero in-school transmission. We see it again and again and again, regardless of age, regardless of grade, but it does require having those layers in place. So the stable groups is one of the layers. And high schools are different from elementary schools. So it's important to highlight that there's high schools are different from elementary schools in terms of COVID transmission, not just in terms of curriculum, which I know as school leadership, you guys are thinking about the curriculum. They're also different in terms of transmission. And this is 2 studies from France early in the pandemic that illustrate that when the community prevalence in this region in France was 9%. There were no precautions in place because it was way early in the pandemic. Nobody had any precautions. They looked at all of the infections in the high schools and in the elementary schools by doing what's called an antibody test, which basically looks at the blood to see, did you ever have an exposure to COVID that your body was responding to? Were you infected by SARS-CoV-2, the virus that causes COVID-19? So they found that 43% of teachers and 38% of students were infected in the high school. In the elementary school, only 7% of teachers and 9% of students were infected. And the implication from that is that transmission can occur in high schools much higher than it was in the community. That implies that there's actually something going on, that the virus is getting transmitted on school site in the high school, as opposed to the elementary school, which reflects just the community prevalence. So there's cases in that elementary school, but it doesn't look like there's like a massive, you know, amount of transmission going on there. So the question is, why would that be true? There's 2 reasons. One is a physiologic reason, meaning something about the bodies of high schoolers. So it's just a physical fact. And that's because ACE2 receptors are the entryway for COVID-19. They're basically the doorway. You don't have to remember the word ACE2 receptor, just remember it's the doorway. That's how SARS-CoV-2, the virus that causes COVID-19, gets into the body. And the weird part is that our ability to make ACE2 receptors varies with age, with elementary students making less ACE2 receptors than middle and high school students who make less ACE2 receptors than adults. So the implication is if you have fewer doors for the virus to get in, you have less disease and more mild disease in the elementary students, but more likely to transmit, or more likely to have disease in the high school and middle school students, which means it's easier to pass around because A, you get it, and B, if you're sick and coughing, you're more likely to pass around actually the more severe symptoms. This is the other reason. I said there were 2. One is a physiologic reason, and the other reason for high schools and middle schools being different from the elementary schools is this level of mixing that happens. And you can see in the elementary school, all those nice stable groups of kids, they just basically hang out with each other in their classroom. They don't go to multiple different classrooms, and they have a couple teachers who are associated with them. As opposed to the high schools and middle schools where there's all these students are mixing all over the place, and the staff is mixing all over the place. And so there's really no ability to contain. If one person in one group here in the elementary schools has an infection, the people who are most likely to get it are gonna just be the people who are close to them here. Here, if one person has an infection, if they're bouncing around and having contact with a ton of other people, it's much, much easier for them to pass it to more people, and much harder to then find where the other infections might have landed in order to try and test those people and have those people stay out of school. So this is the last data slide, which is a really nice and helpful modeling study that somebody did at Cal. Jennifer Head did at Cal, and Justin Ramais. Looking at, they did a modeling study, which means they sort of took data that they already understood by doing a survey and a couple other things, and modeled what it would look like if teachers and students went back to school in the fall. They did the study over the summertime, and they found that without strict interventions to reduce contact, the teachers are going to be at a high risk of infection. And without precautions, the risk of infection among high school and middle school teachers is 4.9 and 3.3 times that of elementary school teachers, based on, you know, what I just explained. Why does that happen? But here's the helpful part. You know, the top line is, what happens if you have no additional precautions? What is the proportion of each group that's going to experience symptomatic illness? You can see for high school, middle school, elementary school, very high rates in high school and middle school, and actually pretty low even without any additional precautions in the elementary schools. Then if you have testing, if you have masks, and if you have stable cohorts, they call cohorts instead of groups, but we'll just say stable groups, you can see stable groups alone by themselves without anything else, masks alone, stable cohorts alone, really decrease the chance of an infection and transmission quite a lot, even in the high school and the middle school. And you can see it's more effective than the monthly testing of teachers. Even the weekly testing of teachers and students is not as compelling as the stable group piece. And they had stable groups of about 20 people. You can see the stable groups assume to be an average of 20 kids. So the summary of the implications: stable groups can provide a key safety layer for all age groups. They're harder to achieve in middle school and high school compared to elementary schools because of that departmentalized curriculum. And therefore, in the guidance, it doesn't say that they're required, but it does talk a lot about how to do it. And the helpful framing is that a small stable group, like an elementary school, that's great if you can do it. You know, if you can't do that, a large stable group is actually better than no stable group. So even a large stable group of like 60 kids is going to be better than a no stable group of a high school of 3,000. So, you know, 60 kids, 150 kids, whatever it is, the more stable grouping you can do, even if it's not the 20, is actually going to be helpful for reducing transmission and spread. So how do you do it? When might you think about implementing it? If it's not already in place, it's like the middle of the semester. What are you talking about? Why are you going to make me, you know, change everything all of a sudden? These are questions that I'm now handing off to Lisa and Stephanie to talk more about it.
Thank you so much, Dr. Bardach, especially for all of your work. I know how much work you've put into all of this and your expertise, so we're very grateful. And now I'm pleased to invite the California Department of Education's Dr. Gregson and Ms. Constancio for their words of wisdom.
Thank you so much, Dr. Dorian, and thank you, Dr. Bardach, for setting us up to talk about the implementation piece. I'm going to share my screen so that we can walk through the implementation and what this can look like. So first, before I start, I just want to thank and acknowledge our school staff and educators and administrators that have been working nonstop over the past year to ensure that our students and families are being taken care of during distance learning and/or in-person instruction. These times have been utterly challenging, both personally and professionally for us all. And it's been hard. So I just want to thank and acknowledge and appreciate you for all that you have been doing to lift up and care for our students and the staff serving them. Even though the pandemic has been hard, it's also created opportunities for us to reflect on our systems that weren't working for every student. And so as I go through this, I encourage you to continue working on eliminating the barriers to student success that existed before the pandemic. We have an opportunity to really think about our instructional programs as we look to invent something new in moving forward with our educational systems. So some overall considerations for planning as you go through your planning process and looking for in-person instruction and looking at your stable groups. And all of this information can be found in our Stronger Together guidance on our CDE website. First and foremost, when you are planning, you considering equity as the foundation for your decisions. So looking at what will be best to serve every student from the very beginning. It's kind of looking at universal design for learning when you're planning your instruction. Same concept as you're planning for this reopening. Also, look at the opportunities to reflect on any barriers that were already existed for students and families to engage in different types of instruction and learning opportunities. Also, thinking about Maslow's hierarchy of needs. Our social-emotional well-being of students and our staff need to be considered at the forefront. If they are not being taken care of, then they will not be in the mindset to be able to learn. And we want them in a great mindset to be able to learn. So looking at what structures and supports do you have in place to take care of the social-emotional well-being of your students and the staff as well. Academic supports. Considering, are these going to be built into the school day or going to be integrated into expanded learning opportunities? But what academic supports will need to be in place to support our students as they go back to in-person instruction? Progress monitoring. How will you set up a feedback loop of understanding your students' growth? Are they meeting the targets that have been set forth? How are you knowing that the system is successful for each of the students? Professional learning. No matter which way you open, whether it's AB or alternative weeks, and we'll go through those different sample schedules, this is a new environment for our teachers. So what kind of supports and opportunities will you have in place for them to learn together with each other and from each other and enhance their skills? Some logistical considerations, space. Looking at your space on campus, looking at your indoor space and your outdoor space. How can you utilize all of them to incorporate them into different learning environments? Next, staffing. Looking at your staffing. Do you have instructional aides that you can incorporate to help with student-teacher ratios and support structures for students? Intervention teachers, librarians, resource specialists, counselors, special ed teachers, or special intervention teachers as well, instructional coaches, custodians, your clerical staff, yard supervisors, school psychologists, assistant principals. Looking at all of your staffing as a resource to be able to get our students back in person. Stakeholder engagement. Have you surveyed your community to better understand what your community needs are, what your students' needs are, the parents and the teachers, because your decision making needs to make sure that those voices are included. A communication plan. How will your messages be delivered about the model that you'll be engaging in going back to in-person instruction, especially if you have different schedules? What is the efficacy of that communication plan? So being able to identify any potential barriers around language, technology. Sometimes that one email just is not enough. So what will be your communication plan? Transportation. Your transportation and nutrition services staff should be a part of the efforts around decision making, because you want that all coordinated with whatever instructional program you're choosing to implement, because you want to make sure that your busing aligns with the instructional schedule, and that if you're having multiple lunches, your nutrition services staff have the support to make that happen. And then your expanded learning partnerships. How are those being utilized to enhance student engagement during this time? They're also great resources for during the school day. An example of that is in Oakland Unified, where we see an expanded learning staff helping teachers engage students during distance learning, but also engaging them and checking in to monitor how they are doing. So taking care of that social emotional well-being and making those connections and building relationships. So here's some sample schedules. Again, these can be found in our Stronger Together guidance. So looking at as you're looking at these sample schedules, here's some considerations that you'll need to think about is your size of your student population. How many students are you serving? What do you want your target size to be for your stable group? And that's dependent on the size of your student population, your available space, and your teacher and support staff resources. You also need to consider, do you want your students with disabilities attending everyday in-person instruction? So looking at the stable groups being assigned to days of week, I have up here a Monday, Wednesday, Tuesday, Thursday schedule. So you may have K2s coming in Monday, Wednesday for 3-6 coming in Tuesday, Thursday, or 7th, 8th coming in Monday, Wednesday. And if you're a 7th through 9th grade school, 9th grade coming in Tuesday, Thursday, or if you're high school, looking at splitting up your grade levels, 9, 10, 11, 12. Either way, thinking about, does that work for you? Monday, Wednesday, Tuesday, Thursday, and then looking at Fridays to being where everybody's in distance learning. So you may be able to focus on small group academic supports and teacher collaboration so that there is progress monitoring happening. Another piece to consider with this type of schedule is we have some schools that are doing Monday, Tuesday, and then Wednesday, Thursday. But looking at, if you're doing Monday, Tuesday, that student is not then going to see their teacher again until the following Monday. So that's 5 days in between that in-person instruction. Do we want to go that long? Would it be better to have Monday, Wednesday, so it's only 4 days? So just those types of considerations need to be a part of the planning process. And again, it goes back to what is going to be best to meet your students' needs, because we want to honor all of the different contexts across our state, because there are many. The other sample schedule that we have seen that has been working in several schools is the AB week model. So stable groups assigned to alternating weeks of in-person instruction. So you're looking at 4 days a week so if we look at middle school or high school, you pick grade levels. Grade levels have AB weeks. They're 4 days a week in person. 1 day is distance learning for teacher collaboration and professional learning, or they're 5 days a week in person, and you may already have a support structure in place for the professional learning for teachers, early release Wednesdays, that type of schedule. But this is where the schedules would alternate, and this is where the communication will be very, very important to your families to ensure they know which week their student would be coming for in-person instruction. Another model that we have seen is an early-late staggered schedule. So we see stable groups that are assigned to an AM or PM rotation, and where students are coming to school in the morning. So the AM rotation comes in the morning and then leaves at lunchtime. The PM rotation would come lunchtime to then an end of day school. So they may be in person for 3 to 4 hours each. Things to think about that is teacher support for that type of rotation schedule, the amount of students within each stable group. If you're elementary and you have multiple recesses, what does that look like for your yard supervision, multiple lunch periods? What kind of support will your nutrition services need to have? And then also transportation. Another model that we have seen is looping, where students loop with their same teacher from the previous year. So you keep them together. This helps with the connections and the building of relationships, because the students already know who their teachers are. If you think about it, we have some kindergartners that have never been on campus and have never met their teacher face-to-face. First graders, same thing. So if you have their kindergarten teacher teach first grade, there's some familiarity there. I personally, when I was teaching, I looped with my students for 4th, 5th, and 6th grade, and it was amazing the relationships we were able to be built during that time. So elementary schools, mentioned this a little bit. Things to think about if you're using stable groups for elementary schools is how many students in one group. Will you have one teacher or a team teaching? As Dr. Bardach showed with her dots, we see that this is really easy. Elementary schools already are in stable groups because we're multiple subject teachers, but how will you use your support staff? And because they will need to be assigned to a stable group. So those are types of considerations you need to consider. Also, when they're going to lunch and recess together, what does that look like for your yard supervision schedules? And to make sure that those students are there together on the playground playing safely and not mixing with too many different groups. You may have to split grade level recesses. And then for middle school and high school. So for middle school and high school, some considerations need to be around student grouping and the types of student groupings, because you want to ensure that your students have the peer interactions that will provide them with different perspectives as they go through their learning experiences. Heterogeneous groups are always best. We've seen some school sites where they're using homogeneous groupings. I would caution programs in looking at homogeneous groupings because again, you want to ensure that there are varied peer models within the classroom to enhance the collaboration and the conversation for the learning experience. Also, stable groups require for the middle school and high school to look at having the teachers rotate, and this provides an opportunity for cross collaboration between content areas. So looking at the themes that are running across math, science, history, and English to have a more integrated approach to instruction. What this would also mean is that, again, you are rotating teachers in and out where the students are staying in one classroom. That means you have to consider your master schedule, what that looks like for prep periods, class offerings, and then again, student access to courses, because you want to make sure that your students have access to any of the courses available to them. And then if you're in block scheduling, you want to consider, is that something that you can do with the Monday, Wednesday, Tuesday, Thursday is already built in? And then do you have those groups stable together with, again, content areas rotating in for block scheduling? So some resources, I'm going to just again reiterate that all of this is expanded on in our Stronger Together guidance. We also have distance learning guidance that goes into grading practices as well that we encourage you to look at. And then I'm going to have Lisa Constancio talk about the rest of our resources.
Thank you, Dr. Gregson. So as Stephanie already mentioned, we do have our Stronger Together guidance that she's referenced here. And a lot of the examples that she referred to are in our Stronger Together guidebook. So we've included the link here. In terms of distance learning, just a little bit additional to what Stephanie, Dr. Gregson already mentioned, we have some information here around designing high quality courses. We have also some examples from lessons in the field that we've learned as we've started through distance learning, and some reference information that we've included on our webpage specific to what we're already hearing in the field. And most recently, just this month, we have posted resources for making local decisions regarding grading student progress. So that's a recent resource document that we just uploaded this February. Also, in terms of our listserv, so every Friday, we send out a weekly email with different updates from the department. The link here is actually how to register to receive this weekly email. We include updates on our work around such things as family engagement, special education, and multilingual supports, for example. We also provide updates around any upcoming webinars that the department is working on and latest initiatives that we're spearheading at the department. And then lastly, the last link here is around our funding resources. Our webpage includes state aid funding that is specific to each school and each school district. We have that continually on our webpage. But the most latest information is specific to the latest round of federal stimulus funds, specifically called the Elementary and Secondary School Emergency Relief Fund. We've just this week posted those preliminary allocation amounts that each school will receive from the $6 billion that's currently allocated to California. And that is to allow schools and school districts to budget appropriately and also to help with the reopening costs. So that's it for CDE at this point. Thank you. And I'm going to turn it back over to Dr. Dorian.
Thank you so much, both of you, for your keen insight and how to move forward. So I'm going to now turn over the virtual podium to our education partners. We're going to start with a round of poignant questions to our state partners, Dr. Bardach, Dr. Gregson, and Ms. Constancio, beginning with Ms. Bianco. So if you guys can turn on your cameras and come on, Ms. Bianco.
Yes, good evening. Thank you. In the California Department of Public Health evidence summary, it states that children most often contract COVID-19 from a household contact. And along those lines, we have heard that schools are the safest place for children, citing this evidence. It's also stated that transmission is low among children due to the mitigation measures in place at schools, hygiene, sanitation, distancing, some of the things we've already discussed this evening. There are questions around the reported number of cases in school-aged children due to lack of testing when a student is excluded from school. What additional information or reassurances are available to us to provide staff and community regarding this?
Thank you for the question. The data that I find most reassuring about that, because it's, and I'll just explain for the people who are listening, because it's a little bit complicated. What happens when, if a case happens in school, often what happens is that anybody who is a close contact to that case goes home and quarantines, meaning they stay at home and they don't try not to have contact with other people while they're trying to figure out, did I catch it from the case in school or not? Those people who are in quarantine may or may not get tested. Sometimes, as many people know, COVID-19 can be totally asymptomatic, no symptoms at all. So somebody might have the infection and kids are less likely to have infection. Somebody could have the infection and not have symptoms, and the younger kids particularly are less likely to have symptoms. And so the concern from the question is, maybe we're missing stuff. Kids are going home, they're waiting around for symptoms, not getting tested. So maybe there's actually a lot of cases in schools, but we're not getting it because we don't consistently test. So that's sort of the premise of the question. And the data that I feel so grateful that they have done this data. There's actually a bunch of different places where we're getting data, but the easiest stuff to cite: New York City does a sampling of testing, a random sample of students and teachers, which means if you're just random sampling everybody in your schools, you're actually capturing a snapshot of the general school population by just doing a 20%, because it's a random. So you're not going to only do the ones who are less likely to get the infection. You're doing a random sample, and they have extremely low rates in New York City of even cases. So that's less than 1%. I actually just looked today on their website, less than 1% of their random sample of students and of teachers who walk onto the campus and have that random testing. So that to me says, okay, the numbers are very low. And the most important other piece of the story is that what the safety mitigation layers are all about is stopping in-school transmission. So it's not just cases. We know cases in school might go up and down because community cases go up and down and people get exposed outside of the school setting. What do we need to do in school setting? Make those layers to stop in-school transmission. And we know that as long as those layers are in place, that you can have very, 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 very little or zero in-school transmission. That's from Marin County, that's from North Carolina, and that's from Wisconsin. Those are the best studies, but we've seen it around the world as well. So, so those are the things that are reassuring to me.
Great, thank you so much, Dr. Bardach, for that. And I just want to again remind everybody that the Safe Schools for All Hub also is a place where you can post some of these questions. Have this also put up there again, the video, so you can come back to listening to how Dr. Bardach sort of talks through some of these answers for you when you're putting together your safety plans. So I want to turn it over to Ms. King.
Hi. So I'd like to ask, what are the risks and the rewards of opening schools prior to all teachers being vaccinated?
So the way out of the pandemic is vaccination, right? That's how we're going to get there. But we have very good data that I just sort of went through a little bit that shows us that if we have those safety mitigation layers in place, and we're not just opening up and we're not just bringing everybody back and nobody's wearing a mask and we're all, snuggling up right close next to each other, like as long as those safety layers are in place, we can have safe in-person instruction. And the benefits of in-person instruction are, deeply felt by everybody who's sending me emails right now about the mental health of their children, which I care deeply about, and the educational outcomes for their children, and the long-term financial stability, both for the kids who are, not getting enough education and are going to have issues with being able to actually support themselves, and for their families and all sorts of things. I also think actually there's a level of isolation for teachers that is actually also hard. And the frustration of not being able to do what you do in person, which is what you're generally feeling like is your level of competence and joy that you get. I've heard from teachers who go back to in-person instruction, the level of, connectedness and joy that they get is real. And so I think there's a mental health effect for the teachers also. So those would be the the benefits, and then, you know, if we can mitigate those risks, then, you know, vaccines are how we're getting out as a society, but they're not a precondition to being able to bring people back for in-person instruction.
Thank you.
Yeah, thank you, Dr. Bardach. I think that's a really important statement, that last statement. And I think it's important. I know you're also working with just labor and just, you know, teacher groups and just kind of getting that message out, the importance of vaccination, but also really the importance of mitigation layers within the school and what that looks like for able to reopen and bring everybody back. So thank you very much. Dr. Lazo, would you like to pose your question?
Yes, thank you. What systems might be put in place for occupational therapists, adapted PE teachers, and other itinerant teachers who see students from multiple groups?
Actually, Stephanie or Lisa, do you want to reflect on that part? Because I can talk about the health and safety, but you might also have some curricular thoughts.
Yes, why don't you start with the healthy safety, and then we can add in on the curriculum end.
Okay, good. Yeah. So there's a couple different potential populations. There is sort of the one-to-one specialized work, and so that's allowed under the guidance around how to work with specialized populations. And it's just you're not allowed to work with multiple different kids. It's just a one-to-one thing. But an adult is allowed to come in and work with one kid across several different settings, but it's always one-to-one. And all those safety mitigation layers still need to be in place. For special ed populations, for a special ed teacher, there are some things around face coverings, and both for the students and for the special ed teachers that we do need to sort of take into account, because the kids who are older, who are developmentally delayed and are less able to cooperate with masks, there's some wording in the guidance about how to allow people to wear face shields if they need to with a drape. And then thinking about how to help people if they have students who are really having trouble with secretions, meaning that they're, you know, very developmentally delayed. And so then I would say there's other pieces of personal protective equipment, gloves, gowns, and stuff like that people would be considering. We don't have guidance that's super explicit about that, but those would be the things that I would say. It kind of just depends on your population, what kind of protections you would want to put in place.
And from the educational program side, looking at what are the students' needs and how are they grouped? Do you have your students with disabilities in person every day together? And so that will help you determine whether, you know, your occupational therapist or adapted PE teacher is assigned to one class and one stable group, and that's the group that they work with. You also need to think about, are the occupational therapists and adapted PE teachers shared across different school sites? And is there an opportunity to contract different services, contract out to where you have more occupational therapists and adapted PE teachers to be able to have that more one-on-one and be assigned to the student, to the stable group?
Thank you.
It's great having both of this, right? Really thinking about how the science works in the schools, which is sort of why we're all here and trying to figure out to do our best in, you know, creating that safe space through the science, but making sure that it works for our schools as we're moving forward. So I think, Ms. Bianco, did you have a second question that you wanted to pose?
I do. Due to the design of the middle school and the high school day, with students moving to different content specialists for each period of their day, what are some promising practices that effectively minimize the risk to so many staff members from one positive contact? Sometimes, you know, teachers teach multiple grade levels.
So that goes back to looking at your stable groups and your teacher resources and the class offerings. And so looking at, if you're looking at middle school, your 7th and 8th grade students, do you have, looking at the heterogeneous grouping of your students, what type of course offerings are they going to have? And then can you have a team of teachers be assigned to that one stable group and be able to provide them the different content areas? The integrated instruction element is very critical for this piece, because if you have 2 teachers that can be able to teach multiple subjects and integrate that instruction, with that one stable group, then you're having an enhanced learning experience for the students as well, and you're decreasing the opportunity to transmit as well. So there's a couple of different considerations there, looking at your staff resources and your schedule and the type of course offerings that you're going to have.
Thank you. Anyways, Ms. Bianco, as with your question, it's always sort of sounds easier than it is, right? It's basically trying to go back and figure out how to make it work directly in your system and what that looks like. Ms. King, I think you had another question as well.
Yes. So I'm a principal of an older high school with an aging ventilation system, and my staff is really worried that they're at a higher risk of contracting COVID due to the recirculated air. Is there anything that I can share with them that might help alleviate some of these fears?
Mm-hmm. A couple things. One thing that you might have already done, it's helpful to have like a mechanical engineer person come and do an assessment of your building. Sometimes schools already have somebody on their staff who is sort of has some of that mechanical engineering background. But that's one thing that I think is just, it's helpful to get that professional opinion, because they sometimes can come up with like, here's a couple simple things that can actually improve the ventilation rather than trying to put in a whole new ventilation system. So that's one thought. And the section and the guidance actually has some nice stuff on ventilation and some really good resources actually. And I think we might be planning on doing I believe that UCLA and Dr. Dorian's team is planning on doing a ventilation webinar in the future. So that's one thing. The other thing to say is we know how to do ventilation wrong. Ventilation wrong is kids in Israel in a middle school where they had a heat wave right after they reopened schools. They had a heat wave. They allowed everybody to take off their masks because it was so hot. They had the air conditioning going, and the air conditioning was blowing across the room. So there was zero ventilation, and there's a strong air current that allows the infection to spread. So inward directing air currents is really bad. Don't do it. And if you have at least 2 points of ventilation open, that can help. So one window, one door, that works. And even an outward facing fan, that can actually like really help recirculate the air. So there's some kind of simple things to do. And then the last thing to say, there was another dramatic example actually of a restaurant in South Korea that the same kind of thing. It's like teaching us what not to do. No open vents and air conditioning pushing so hard that it actually made the light. They had a video of the light fixture moving. That also led to a lot of transmission across a far distance in a restaurant where people had their masks off. So that's what and of the schools that we know that are succeeding well, like the North Carolina study, et cetera, they didn't have a big ventilation push of like everybody had MERV 13. Their focus was masking, physical distancing, and hand hygiene. So so that's just, the data is not perfect, but those are the things that I sort of think about as we figure out what is the right answer for ventilation.
Thank you.
I think, Dr. Bardach, one of the things that we can see, and I think it's important in this webinar to kind of capture, is the thinking process. And really, there is no one answer, right? Really, just like as you're thinking about it, there's so many ways to do it. But really, in the end, it's about what will work within that school building and how many of those mitigation pieces can you put together to really think about that, Swiss cheese model that we've been seeing, really kind of putting it all together. So I think it's important because a lot of schools and administrators, we come to a point of how do we make this happen? And sometimes we always think about the ideal or the one that has to be perfect, right? Whereas we can think about some of these smaller pieces that'll help us start moving forward and addressing those. So thank you. And I think Dr. Lazo, you also have one last question.
Yeah, thank you. So for smaller schools and smaller local educational agencies that do not have substitute teacher pools, what suggestions might you have for how to manage the need for unplanned absences given stable group requirements?
Well, this is definitely a statewide issue, especially around teacher shortage. So some elements to think about is bringing back retired teachers and having them be a part of your substitute pool. The student teachers, the connection with any universities, with their student teaching programs, and making connections there to have them be substitutes, and also working with your county office of education and the resources and supports they have there to build the substitute pool as well.
Great, and I think Dr. Bardach, that may also be, there is sort of that health aspect, which is, introducing a new person into the stable group if need be. So what does that look like, right? If you have a substitute that isn't always there, but needs to come in for that moment, how would we think about that?
Yeah, great question. And we don't have any specific guidance, to sort of speak to that. I think the basic mitigation layers are still important. The masking and the physical distancing are probably even more important. So that substitute teacher ideally is going to be doing even less, like leaning over the student's shoulder. Like we say in the guidance, we know that your physical distancing can't be perfect all the time. You're going to go over and like help the student sometimes. So that substitute hopefully is doing a little bit less, right? This is where you just like, you do your best, you try to mitigate as much as you can. To your point, Dr. Dorian, like you don't, we're not going to be able to make everything perfect. Some people, as we get more access to antigen testing, which is like the easy on-site testing, some people are talking about trying to do a little bit more antigen testing for their substitute teachers. So that's another thing that people are talking about, getting that up and running. There are, the Valencia branch lab we're working on developing an antigen solution for people to be able to access more. So that would be the only other thing that sort of people are talking about. But again, I would say that's not necessary. It's in order to allow for safety with a substitute situation.
Again, thank you. And I think part of it is just this, sorry, Stephanie, I'm to cut you off, so come on back in, but just this idea of all of us being able to continuously talk and think about best practices that we can share that others are using. And I think that that's probably the most important part of these webinars, is really bringing those successes that people have been putting into place to answer some of these questions. Dr. Gregson, sorry, I cut you off.
No, I was just going to add in around building the substitute teacher pool is also working with your expanded learning programs. We have many of our expanded learning staff who want to become teachers, and so they're a great pool to get into getting their emergency credential and being able to substitute, especially because they already have relationships with the students.
That's great. So I'm going to take the time as a moderator to ask, well, there's one question, there's a lot of questions, by the way, but I'm going to ask one, which since we have Dr. Gregson on the line, it says, in the sample schedule covered by Dr. Gregson, there was a schedule that had a distance learning day. Is that an option when legislation requires daily live interaction with the teacher?
So I would ask which legislation is requiring daily live interaction, because our legislation right now is really about instructional minutes and student engagement and tracking that element. So we know that a form of distance learning may continue forward. And so looking at how do we utilize that in the best possible way to meet the needs of every one of our students. We know that some students have thrived in distance learning and some students have struggled. And so wanting to keep an open mind around our educational systems, how do we utilize it to the best possible way to meet students' needs?
That's great. Thank you so much. And I think, do I have time for one more? I'm going to ask it. And I think it's something we've been saying, but I'd like to reiterate it. I think more than anything, for everybody to realize we're all feeling the same anxiety as we're going through this reopening plan. And it comes back to stable grouping in high schools, really thinking around AP classes and sort of what does that look like when we have that kind of specialized services, and how do we then keep those students together as we're moving through with teachers rotating?
Yes, that's where those smaller learning communities can come in place, where you have students that are taking courses together. I'll use my own daughter as an example, sophomore in high school. She's in a small learning community, and she has a cohort or stable group of students that are together in distance learning right now, but we're hoping for in-person soon. And they then share a group of teachers. So they have the same teachers within that entire program. So their AP teachers all are together for both 9th, 10th, and 11th grade. And so they're exposed to less amount of teachers. And so that smaller learning community is one way to look at it. Also looking at your pool of specialized teachers and looking to see what their capacity is as far as course offerings, and can you have them take on multiple grade levels and being able to teach the AP English for 9th and 10th grade or 11th and 12th grade, so that you are utilizing that to the best of the ability to make sure that they are staying with a stable group of students.
Right. And also sort of thinking about some of the things you were saying, where maybe some of the elective or those other classes could be online. So the hybrid or the distance learning piece can sort of take care of some of those things too. So we have come to the end, and I am so very grateful for all of you to be here, sharing your valuable time with us. Thank you, esteemed panelists, for your wisdom and insight. As I mentioned in the beginning, this is the first of a series of webinars coming. We really want these webinars to provide school administrators with a forum to dialogue and work with our subject matter experts to better understand how to implement these guidances into specific needs and realities of our schools and our school buildings. So our next webinar will be next Thursday. We're going to try to do a few Thursdays in a row. Again, February 18th from 4 to 5 p.m. We're going to focus on pediatric COVID research, best practices on school reopenings. We're going to try to really gather some of those best practices, as Dr. Bardach was talking about, of schools that have been reopening and thinking about it. And then we're going to have ones on school-based testing, exposure manager, case investigation, contact tracing, what that looks like between you and your local health jurisdiction, equity in schools, and ventilation. So again, thank you all for being here, and I look forward to seeing you all next week. Have a great day.